skin cancer and 4 real tips on what to watch out for if you are worried about skin cancer. Hi and welcome to another issue of the Vysana Life newsletter. Hi, I'm Dr. Dhesi and I've got some interesting tips, hints and stuff from clinic to bring to you. So the first one we're going to talk about this week is about skin cancer. I want to talk to you about things to watch out for. So this one is all about what should I watch out for in terms of if I'm worried about skin cancer, what are the signs, what are the symptoms, and when and where should I go and seek help. We're going to talk a little bit as always, mindfulness, medicine and menopause. This week, the medicine aspect is going to be about weight. It's going to be about obesity. I watched a very interesting webinar from a specialist consultant this week, and I want to share some of the information with you. And as always, I will share with you what's the top treatment in clinic this week and why are we doing it? Why are patients coming in? So if you haven't already subscribed to our YouTube channel, please do. It's Vysana Life, and I hope that you are enjoying these. We do need comments, we do need feedback, we do get questions now and again, but the more engagement I get, the more I can actually do the things that you want to listen and hear about. So once again, thanks for watching. If you haven't already subscribed, please do, and I look forward to sharing what I enjoy doing in clinic. Skin cancer and 4 real tips on what to watch out for if you are worried about skin cancer. So we are heading now into the summer months. The sun is out, everyone's out and about, and you might have noticed a change on your skin. So normally, because we're in the sun, our skin might get a bit of color, we might tan, we kind of ignore what appears, but increasingly, perhaps it's because of increased sun exposure, perhaps a lack of awareness, especially if you're in your late 30s and 40s when applying sunscreen wasn't a thing. This is the time now to really seek help, and this is really about next steps. So firstly, if you notice a new mole or a new change in an existing mole, it may be the signs of skin cancer. So skin cancers come in various forms. We can have melanomas, we can have basal cell carcinomas or squamous cell carcinomas. The thing that we really want to watch out for is changes in pigmented skin lesions, so moles. So if you notice the change, it's got bigger, it's changed in any way, definitely seek advice or help from your GP or healthcare practitioner. Melanomas can appear anywhere in the body, so they're more common in areas that are exposed to the sun. So for example, the sides of the head, the tops of the ears, on the neck, on the back, if you've ever been sunburnt on your back. So that's always a difficult one. So if you have someone at home who will kindly oblige, get them to regularly just check the back and also check theirs as well. So any new signs or changes, that would be definitely one to go and check in with your GP or your dermatologist or whoever looks and checks after your skin. The third one, there are some rarer types of skin cancers, and they can affect the eyes, they can affect the soles of the feet, they can affect the palms, the hands, or even the genital area. So if you notice a new change there, don't sort of ignore it. Definitely get someone to check it out for you. And lastly, always check your skin for any unusual changes. So that, as I mentioned before, this is sort of the last tip. It's about sharing and checking. So check your partner and get them to check your skin. And also, it doesn't matter how old you are or what skin type you have, even if you're a darker skin type, still I would recommend checking your skin. If you are worried, what is it, I've seen something, then what do I look out for? Well, as I said before, if it's change in pigmentation, if it's become more irregular, if it's got bigger, if it's bleeding, anything like that, then definitely seek advice. Next steps, always seek professional advice from someone who's qualified to check. If you go to your GP and they're not quite sure, they will refer you on to a dermatologist. If you cannot get in with your GP, we do offer a service here. It's from a company called Map My Mole. We have a little lens that we attach onto our phone essentially. We can take an image, we can send it to a dermatologist, they will send back a report, and from that report we will be able to work out what we can do. So if it's benign and it can just be removed, then that can be done sometimes with liquid nitrogen or cryotherapy if it's a cosmetic thing. However, if it is a skin cancer or there's a risk of it being a skin cancer, then we can give that report to you, and then we can either refer you to a dermatologist privately, or you can go back to your GP and seek an NHS referral. So I hope that's been useful. The reason I'm bringing it up is because it's this time of year and we tend to lose track or lose sight of change in the skin because you think, oh, it's just something that's happened in the sun. We've had patients who've come in and they thought actually it was the
the pigment or the mole was actually from an injection site. We might have done some, for example, a skin boost on the body. And when we've looked at pictures, there's always been something there, but actually what has happened is that it's actually got bigger and it's actually become more suspicious. And that's why, if those of you are watching and you come to clinic, why do I take so many pictures? Because we can get a sequential change in skin over the years, depending how long you've been to sort of see me. So I hope that's been useful. That's all about skin cancer, 4 really important pieces of information there. Thanks for watching. This week we've been focusing on obesity or being overweight. Obesity is a characterized disease where you have excess body fat. Now, it's a very controversial area. Why am I bringing it up this week? So I think I've had a lot more discussions with patients about body image, about how they feel, how they've been putting on weight. Obviously during perimenopause and menopause with hormonal changes, women do put more weight on, and there's various factors for that. I think what I wanted to share this week is some key points from the webinar or conference kind of call that I watched with a very, very good consultant. And firstly, it's that obesity, we have to start considering it as a disease. It's not simply a case of calories in, calories out, because if that was the case, then the diet industry wouldn't exist, the supplement industry wouldn't exist, medications, which I will mention, things like Ozempic, Wegovy, Mandurin, they wouldn't exist unless there was this place here. Now, again, I'm sure there's always a controversy about big pharma or big, not as in farmers, but pharmaceutical companies, a bit of slang term there, and that this is all just a conspiracy. But I think the first thing we have to understand is that we are all conscious. We're potentially going to go on holiday. We've noticed as we've got older, we've put on more excess body fat. What's the reason for that? We might put the blame down to how we eat, how we drink, the lack of exercise, and those factors do play a role. But if we start to consider obesity as a disease, as a chronic disease, and laying down excess fat is sometimes multifactorial, there's psychological elements, there's physiological elements, and maybe step away from thinking it's just about what goes in, what goes out. It's not as simple as that. So that's always my first tip when talking about obesity with patients, and also focusing on what their goals are. So it's not so much about losing the excess fat or getting to a target weight. Those are black and white measurements. What we really want to think is, how will this make me feel? What is it that's driving me? What has made me be in this situation? And in a lot of cases, it's a work-life balance. Work is overtaken. If you're doing a sedentary job like me, I'm sitting down, you're not as active, that does play a role. Psychological stress, if you're stressed a lot of time, a lot of us will turn to eating. Those things need to be tackled. So I think if you're watching this, I want to give you a bit of positivity in that, speak to a professional. It's not all about calories in and calories out. It's more about understanding the multifactorial elements. We can lay the blame down at ultra-processed food. We know that can change your brain chemistry and lead to eating in different ways and changing our eating habits. But equally, if we start considering this as a disease state, and I know that some people will look at this and Dr. you're over-medicalizing something. It's down to laziness, it's down to people not exercising enough. Of course it is, but there are so many more stress elements in our lives that what I want you to do is not get downhearted about it. Seek advice from a professional. We do discuss this a lot in clinic. We don't prescribe those medications that I mentioned, but we do have partner clinics that do. And I think that's always a good start, especially if you're struggling. There is no need to struggle and no need to feel ashamed. Any GP, like myself, whether NHS or private, would be more than happy to discuss those concerns. So, bit of positivity, take a step. Look at it's a multifactorial problem, and sometimes it's just a case of getting all that stress off you, and it's a cathartic process. And we can talk about that in clinic if you're so interested. If not, then I thank you for watching up until this point.
And lastly, I'm in danger of showing a very messy work surface. I'm just in the process of tidying up at the moment. In the background, you can probably see our needle box. There's some filler boxes over there. But I wanted to share with you this little machine that we have here. This is our centrifuge. It's not on at the moment, so if I click door, it won't open. There's no power to it. And also, what do we have here? We have a pure rich parts. This is our PRP pack. So basically, what is the treatment of this week being? We do a lot of microneedling. We do a lot of microneedling with either our Tribella machine, which is just here, the Venus Versa, or if you're watching this and getting slightly seasick, we use our skin pen, which we attach a disposable needle on, which I'll show you now. Microneedling is a very, just make sure that gets charged, otherwise next time I can have a patient coming in, it will run out. And this is the point where you see me fall over and trip over. As I was saying, microneedling is a really versatile treatment. We can add elements to it and we can take elements off. It's going to show you a little needle pack. So this is our skin pen needle pack. And inside here, inside the kit, we have solutions to help with the microneedling itself. And I wanted to show you this, which is the needle kit itself. That's a little sheath that goes over the device. Ta-da! Drum roll, please. And here is the needle element. So you can just about see underneath there the little needles that go in, and you can see these little numbers on the side here, and that is there for altering the depth. So we can go up to, I think, 2 millimeters on a skin pen, or a little bit lower. So apologies for the shakiness of the video, that's me getting excited and moving around. So microneedling has been the go-to treatment, and what we have been doing is adding in things like hyaluronic acid, vitamin C. We've also been using the centrifuge to spin down blood. Some people call it vampire facial. I think that's a really wrong way of thinking about it. It's, we do take blood, but we put it back in again. It's not like you're drinking it. I struggled there to describe what I was actually going to say without swearing. But what I will say to you is that microneedling, very versatile treatment, usually 3 or 4. It helps with fine lines and wrinkles. It makes the skin resilient. Sometimes we use it with patients with rosacea. Definitely using PRP, which is taking the blood, spinning it down in the plasma, combining it with hyaluronic acid and putting that into the skin, really can stimulate the skin to help rejuvenate it and regenerate it. The microneedling itself is beneficial by itself, but adding elements in can be really beneficial too. So that is it. That's our treatment of the week. That is on the menu. That's microneedling with PRP. And if you are interested, please do DM us. Don't DM us, email us at information@vysana.com or give us a call. Thank you for watching this week's newsletter. I'm now in our little kitchenette, which is usually closed off from a sliding door. This is where, obviously there's a Hoover in the background. This is where we I take a little bit of break to have a bit of a coffee. We have an espresso machine here, plenty of water, stay hydrated, and that is what I'm going to leave you on. Make sure that you stay hydrated. It's very easy to become dehydrated in the summer months. You should be drinking enough water, at least so that you are having to have a wee every couple of hours or so, and your wee should be like, this is going to get me into trouble, but the colour of plasma, so a nice straw coloured fluid, very yellow, not like Lucozade. So I hope you've enjoyed this week's newsletter. I've tried to mix it up a little bit. Please do leave comments. Please do subscribe to us on the YouTube channel, and I do enjoy doing this and I'd love the feedback. Thanks very much for watching. I'm Dr. Dhesi, and this is Vysana Life.